You're about to go to bed tonight. You lie down on your pillow, get comfortable, and drift off to sleep, just like you have for the last 40 years. But what if I told you that the way you're sleeping right now could silently damage your heart and brain while you're completely unaware? I'm a retired cardiac surgeon with 30 years of experience, and I've seen too many patients in their 60s, 70s, and 80s suffer strokes that could have been prevented simply by changing how they sleep. Stay with me for the next few minutes. This could save your life. Hello, and thank you for being here. My name is Dr. James Harrison, and I spent 3 decades in operating rooms, performing heart surgeries on seniors just like you. Over the years, I noticed something fascinating, and honestly, quite alarming. Many of my patients who suffered strokes, heart attacks, and dangerous heart rhythms all had one thing in common. They had a specific sleeping habit that put tremendous strain on their cardiovascular system night after night, year after year. The scary part? Most people over 60 do this without realizing the danger. Some of you watching right now are probably doing it tonight. The good news is that once you understand what's happening in your body while you sleep, you can make a simple change that could protect your heart, your brain, and potentially add years to your life. This isn't about fear-mongering, this is about empowerment. Once you know the truth, you can act on it. And that's what we're here to do today. Let me be direct with you. Stroke is the 5th leading cause of death in America, and it's the leading cause of disability in adults. Every 40 seconds, someone in this country has a stroke. Every 4 minutes, someone dies from one. Now here's what most people don't realize. Your risk of stroke doesn't just depend on what you eat or how much you exercise, though those things matter. It also depends heavily on what happens to your body while you're sleeping, when you have absolutely no control over your heart rate, your blood pressure, or your breathing. For people over 60, this becomes even more critical. Why? Because our cardiovascular system isn't as resilient as it was in our 30s and 40s. Our arteries are less flexible. Our hearts work a little harder. Our nervous system is more sensitive to stress and position. When we add a harmful sleeping position to these natural changes, we're essentially asking our heart and brain to work against us for 8 hours every single night. Think about it this way. If you spend a third of your life sleeping and that third of your life is putting strain on your most vital organs, wouldn't you want to know about it and fix it? That's exactly why I'm sharing this with you today. So, let's talk about the sleeping position that's causing all this trouble. The position I'm referring to is sleeping on your right side or sleeping on your back with your head turned to the right, and even more problematic, sleeping on your back with your chin tucked down toward your chest. Now, you might be thinking, Doc, I've been sleeping this way my whole life. How can it suddenly be dangerous? Great question. Let me explain what's actually happening in your body. When you sleep on your back with your chin down, or when you sleep heavily on your right side, you're essentially compressing the major blood vessels that supply your brain and heart. You're also changing the natural alignment of your neck, which houses the carotid arteries, the main highways that bring blood to your brain. Here's the physiological reality. As we age, our carotid arteries naturally lose elasticity and develop small plaques from cholesterol buildup. It's not a disease, it's just part of aging. But when you add a sleeping position that kinks or compresses those arteries, you're creating the perfect storm. That compression reduces blood flow. Reduced blood flow causes your brain to become oxygen deprived. Your body senses this, and it triggers inflammation. Inflammation makes your blood stickier and more prone to clotting. And a clot in one of those neck arteries? That's how strokes happen, often without any warning whatsoever. But there's more. When you compress your carotid arteries night after night for years, you're actually accelerating plaque buildup in those vessels. You're damaging the delicate inner lining of those arteries. Over time, this creates a ticking time bomb. I've performed emergency surgeries on patients who had no idea their sleeping position was slowly setting them up for a catastrophic stroke. They would tell me, "Doctor, I felt fine. I had no symptoms. I was getting my rest." And that's the tragedy of it. You can be silently harming yourself every single night and never feel a thing until it's too late. The other issue is heart rhythm. When you sleep on your right side or in certain back positions, you put pressure on your heart itself. This can trigger something called atrial fibrillation, irregular heartbeats that dramatically increase stroke risk. Many of my patients discovered they had AFib only after they suffered a stroke. If only they'd known to change their sleeping position. Now, I want to give you some warning signs that you might be experiencing problems related to your sleeping position. If you recognize any of these, please pay attention. First, waking up with neck pain or stiffness. This is your body's way of telling you that your neck is being stressed during sleep. Your cervical spine, that's your neck, contains all those vital blood vessels I mentioned. When you wake up with neck pain, it means you've been compressing those vessels and the muscles around them all night long. Many seniors think this is just part of getting older. Oh, my neck hurts when I wake up. That's normal at my age. No, it's not normal. It's a sign that your sleeping position needs to change. Second, waking up. Feeling groggy or brain fog. If you wake up feeling like your head is full of cotton, that you can't think clearly, or that it takes hours to feel mentally sharp, this could indicate that your brain didn't receive optimal blood flow and oxygen during the night. Many of my patients describe this as waking up on the wrong side of the bed. But it wasn't about which side, it was about the position cutting off blood flow to their brain. When you fix the position, the brain fog often clears up within days. Third, frequent headaches, especially upon waking tension. Headaches that start in the base of your skull or behind your eyes when you wake up are classic signs of compressed carotid arteries. Your brain is struggling to get enough oxygen-rich blood, and it tells you through pain. Fourth, feeling dizzy or lightheaded when you stand up. When you've been sleeping in a position that restricts blood flow to your brain, your body's ability to regulate blood pressure during position changes gets compromised. You stand up, and suddenly the room spins. That's dangerous because falls are a major risk for seniors. Fifth, excessive snoring or breathing pauses. If you or your partner has noticed that you snore loudly or seem to stop breathing during sleep, this is a critical warning sign. When your neck is compressed, your airway closes partially. Your body compensates by snoring. In severe cases, you might have sleep apnea, where you actually stop breathing for seconds at a time. Each time this happens, your oxygen levels drop. Your heart has to work harder. Your blood pressure spikes. This is absolutely devastating for stroke risk. Sixth, high blood pressure. That's hard to control. Here's something many doctors don't mention. If your sleeping position is compressing your carotid arteries and triggering sleep apnea, your body is constantly in a state of stress. That stress triggers adrenaline release. That adrenaline raises your blood pressure, not just at night, but throughout the day. Some of my patients who couldn't get their blood pressure under control with medication found that changing their sleeping position helped normalize their readings. Some even reduced their blood pressure medications with their doctor's approval. Seventh, sudden weakness or numbness on one side of your body. This is the most serious warning sign. If you wake up and notice that one arm or one leg feels weak, numb, or tingly, or if one side of your face feels droopy, you need to call 911 immediately. This could indicate a minor stroke, what we call a TIA or transient ischemic attack. Even if the symptoms go away after a few minutes, you must seek emergency medical care. A TIA is nature's warning sign. Your body is telling you that something is terribly wrong with your blood flow. This is your last chance to prevent a major disabling stroke. Now, here's something important I want you to understand. Not everyone who sleeps in a problematic position will have all these symptoms. Some people might have none of them and still be at risk. That's because the damage is often silent. It's happening at a microscopic level inside your blood vessels. That's why prevention is so important. You don't want to wait for symptoms. You want to make changes now, before a stroke happens. If you're over 60 or you're caring for an elderly loved one, I want you to really think about what I've just shared with you. Maybe you're recognizing yourself in some of these warning signs. Maybe you're thinking about your spouse or your parent who snores loudly or wakes up with headaches. This information could genuinely be life-saving, and I mean that not as a figure of speech, but literally. A simple change in sleeping position could prevent a stroke that would otherwise leave you disabled or worse. I've seen people lose their independence, their ability to speak, their ability to care for themselves, all because they didn't know about this risk. But you do know now. So let's talk about what you can actually do about it. Alright, so now you understand the problem. Let me give you the solution. The safest sleeping position for your cardiovascular health, especially as you get older, is sleeping on your left side, but not just any left side position. Let me describe exactly how to do this correctly. The ideal left side position. First, lie on your left side. Your body should be relatively straight, with your left arm either extended in front of you or tucked comfortably at your side. Your right arm should rest on top of your right hip or extended in front of you for balance. Your pillow should support your head and neck in a neutral position, meaning your head should be aligned with your spine. Imagine a straight line running from the top of your head through your spine to your feet. Your pillow shouldn't be too high, which would tilt your head forward, or too low, which would tilt your head backward. Your neck should never be twisted. Your chin should not be tucked down toward your chest. You should be able to draw a straight line from your nose straight ahead, not angled upward or downward. For your knees, place a pillow between them. This keeps your spine properly aligned and reduces stress on your lower back. Why left side specifically? Several reasons. First, when you sleep on your left side, you reduce pressure on your right carotid artery and your aorta, your heart's main artery. Your heart itself is positioned on the left side of your chest, so lying on your left side actually reduces direct pressure on your heart. Second, sleeping on your left side improves lymphatic drainage, which helps your body eliminate toxins. It also improves blood flow to your heart more effectively than other positions. Third, left side sleeping has been shown in studies to reduce snoring and sleep apnea in most people. Now I hear some of you saying, "But doc, I've been a back sleeper my whole life, or I've always slept on my right side. This will take me forever to adjust." And you're right. It will take adjustment, but let me tell you something. Every single night you sleep in the healthier position is a night you're protecting your brain and heart. Every single night. Most people adjust within 2 to 3 weeks. Your body actually wants to adapt. What feels uncomfortable on night 1 starts feeling normal by night 5 or 6. Making the transition. If you've been sleeping on your back or right side for decades, here's how to make the switch easier. Start by sleeping on your left side for just part of the night, maybe the first few hours. Then you can roll onto your right side or back for the remainder if needed. Over a week or two, gradually increase how long you stay on your left side. Use good pillows. Invest in a pillow specifically designed for side sleepers. Your neck deserves support. It's carrying about 12 pounds of head all night long. That's like carrying a bowling ball on your neck. Give it proper support. Use a body pillow. This wonderful invention helps you maintain the left side position throughout the night without effort. You simply hug it or position it against your back to prevent yourself from rolling onto your right side. If side sleeping really isn't working for you, the second best position is back sleeping, but only if your head and neck are properly supported in a neutral position. Your pillow should support your neck's natural curve. Your chin should not be tucked. Many people do back sleeping incorrectly, which is why it's less ideal than left side sleeping. The position to absolutely avoid is sleeping on your stomach. When you sleep on your stomach, you have to turn your head 90 degrees, which completely kinks your carotid arteries. This is probably the worst sleeping position for stroke risk, so if you're a stomach sleeper, this change to your side sleeping is especially important for you. Additional support tips. In addition to changing your position, there are other things you can do to optimize your cardiovascular health during sleep. Keep your bedroom cool. Around 65 to 68 degrees Fahrenheit is ideal. Cooler temperatures improve sleep quality and help your heart work more efficiently. Make sure you have a firm, supportive mattress. A mattress that's too soft will allow your spine to sink in, creating awkward angles in your neck. Avoid large meals 2 to 3 hours before bed. Digestion increases the workload on your heart. Stay hydrated during the day, but taper off fluids an hour before bed. Dehydration increases blood thickness and stroke risk. but you don't want to wake up 4 times a night to use the bathroom, which disrupts sleep quality. Elevate your head slightly, about 30 degrees, if you have any heart condition or sleep apnea. This improves blood flow and breathing. If you have acid reflux, which is common in older adults, elevating your head helps prevent stomach acid from rising, which is another reason to avoid flat back sleeping. Additional protective measures, 14-30-17. Now, changing your sleeping position is incredibly important, but it's not the only thing you should be doing to protect yourself from stroke. Let me give you some additional protective measures that work together with proper sleeping position to create a comprehensive stroke prevention plan. First, know your blood pressure. You should know your blood pressure as well as you know your name. Ideally, it should be below 120/80. If it's consistently above 130/80, you need to talk to your doctor about medications or lifestyle changes. Here's why this matters for sleep. Blood pressure naturally rises slightly during sleep as part of your normal circadian rhythm. If you're already on the edge of high blood pressure during the day, that nighttime increase could push you into dangerous territory, especially if your sleeping position is adding stress. Second, manage inflammation. Chronic inflammation is like a slow-burning fire in your arteries. It damages the inner lining of your blood vessels and accelerates plaque buildup. Eat foods that reduce inflammation, fatty fish like salmon and sardines, olive oil, nuts, berries, and leafy greens. Avoid foods that increase inflammation, processed foods, excess sugar, and unhealthy fats. Third, stay active. You don't need to train for a marathon, but 30 minutes of moderate activity most days of the week, a brisk walk, swimming, gardening, dancing, keeps your cardiovascular system strong and prevents clots from forming. Fourth, don't ignore irregular heartbeats. Some of you reading this might experience palpitations, that fluttery feeling in your chest, or a sensation that your heart is racing or skipping beats. Many people ignore these episodes. "Oh, it's just my heart acting up. It'll pass." Don't ignore it. See your doctor, get an EKG. Irregular heartbeats significantly increase stroke risk, and they're often very treatable. Fifth, sleep apnea screening. If your partner tells you that you snore loudly or stop breathing during sleep, you need to be screened for sleep apnea. This is non-negotiable. Sleep apnea is a major stroke risk factor, and it's treatable. Your doctor can arrange a sleep study. In many cases, a simple device like a CPAP machine, which gently keeps your airway open while you sleep, can literally save your life. Sixth, manage diabetes and blood sugar. If you're diabetic or pre-diabetic, tight blood sugar control is crucial for stroke prevention. High blood sugar damages blood vessels and makes blood clottier. Seventh, medication compliance. If you've been prescribed blood pressure medications, blood thinners, statins, or other cardiovascular medications, take them exactly as prescribed. Don't skip doses. Don't stop taking them without talking to your doctor. I've had patients tell me they felt fine, so they stopped their blood pressure medication. Weeks later, they had a stroke. The medication was working. That's why they felt fine. That's the whole point. Eighth, manage stress. Chronic stress keeps your body in a state of high alert. Your nervous system releases adrenaline and cortisol. Your blood pressure stays elevated. Your blood becomes stickier. Find ways to reduce stress. Meditation, deep breathing, time with loved ones, hobbies you enjoy. Even 10 minutes a day of quiet, peaceful activity can make a difference. Ninth, stay connected socially. This might sound unrelated to stroke risk, but it's not. Loneliness and social isolation increase stroke risk by about 30%. Stay connected to family and friends. Join groups. Volunteer. Your brain and heart thrive when you feel connected to others. I want to share a couple of brief stories that I think will resonate with you. I had a patient named Margaret. She was 67 years old when she came to see me. She'd been experiencing occasional dizziness and headaches that she'd attributed to normal aging. Her daughter had read about sleeping positions and stroke risk online and convinced her to come see a cardiologist. We did some imaging and found that Margaret had significant narrowing in her left carotid artery, the kind of narrowing that often leads to stroke within a couple of years if untreated. We treated her condition, yes, but she also started sleeping on her left side. 3 years later, she sent me a note saying, "Doctor, I feel better than I have in years. My headaches are gone. The brain fog is gone. I wish I'd known about this sooner." I had another patient, Robert, who was a back sleeper his whole life. His wife mentioned that he snored loudly and seemed to stop breathing sometimes. Reluctant, he came to see me. We found he had significant sleep apnea, and yes, he was compressing his carotid arteries with the way he was sleeping and breathing. We got him a CPAP machine and trained him to sleep on his left side. 6 months later, his wife told me he was like a new man. He had energy he hadn't had in years. His blood pressure medication was reduced. He was sleeping better and waking up refreshed. These stories aren't unique. I've heard versions of them hundreds of times. The encouraging part is this: it's never too late to make a change. Your body is incredibly resilient. Even after years of sleeping in a harmful position, your blood vessels can improve when you reduce that strain. You don't need surgery, you don't need expensive medications, you just need to know the truth and take action. Before we wrap up, I want to address some concerns you might have. What if I have back pain or other conditions that make side sleeping difficult? Talk to your doctor or physical therapist. There are ways to modify left side sleeping to accommodate back pain. Often, the right pillow setup or mattress adjustment solves the problem. In some cases, you might need a hybrid approach where you alternate between left side and properly supported back sleeping. What if I'm already on blood thinners because of my heart condition? That's actually even more reason to reduce other stroke risk factors. Your sleeping position becomes even more important. How long before I feel the benefits? Many people feel better, clearer, less groggy, fewer headaches within a week or two. Some people feel changes in days, but the internal vascular benefits take longer. Your arteries need weeks or months of reduced compression to begin healing, so stick with it even if you don't immediately feel different. What if I live alone and roll around a lot? That body pillow I mentioned becomes your best friend. It's surprisingly effective at keeping you in position without restricting movement. What if I've already had a stroke? Then this is absolutely critical. You need to be doing everything possible to prevent another stroke, and changing your sleeping position is part of that comprehensive plan. Summary and strong closing. 20, Hauntier 21, 15. Let me bring this all together. We've learned that sleeping in certain positions, especially on your right side or back with your head turned or tilted, can compress the blood vessels that supply your brain. Over time, this increases your risk of stroke, a condition that could rob you of your independence, your speech, your mobility, or your life. We've learned that this problem is silent. You might not feel anything wrong for years. That's why prevention is so critical. We've learned that the solution is straightforward. Sleep on your left side, with proper pillow and mattress support to keep your head and neck in neutral alignment. We've learned that this change takes about 2 to 3 weeks to adjust to, but the payoff is immense. We've learned that sleeping position is one part of a larger stroke prevention strategy that includes managing blood pressure, staying active, getting adequate sleep, managing stress, and working closely with your healthcare provider. Most importantly, we've learned that you have more control over your health than you might realize. You can't control your age, and you can't undo decades of living, but you can control what you do starting tonight. Your brain and your heart have been faithfully serving you for 60, 70, 80 years or more. They've kept you alive through everything life has thrown at you. They deserve the same care and respect you'd give to any precious thing in your life. Making this change isn't just about avoiding stroke, though that's critically important. It's about taking an active role in your own health. It's about respecting your body. It's about saying, I value my life, my independence, and my future, and I'm willing to make a simple change to protect all of those things. That's powerful. That's something to be proud of. Now, here's what I'd like to ask of you. First, if this information resonated with you, please subscribe to this channel. I create content specifically for people over 60 who want to take control of their health. New videos come out regularly, and you won't want to miss them. Second, share this video with your family members. Maybe your spouse snores, maybe your adult children are concerned about your health. Share this with them. Sometimes hearing it from a source outside the family makes a bigger impact. Third, if you related to any of the warning signs I mentioned, the neck pain, the brain fog, the headaches, the dizziness, please talk to your doctor about it. Bring up this sleeping position issue. Most good doctors will be glad you're thinking about this. Fourth, leave a comment below. Tell me, are you going to make this change? Do you recognize yourself in any of these warning signs? Have you already noticed improvements from changing your sleep position? I read every comment, and your stories help other people realize they're not alone. And finally, most importantly, tonight when you go to bed, try sleeping on your left side. Just try it. See how it feels. Give it a few nights before you judge it. Your future self will thank you for it. Thank you so much for watching. Take care of yourself, your worth,